Look, I know you're getting as tired of hearing about this as I am of covering it, but we gotta talk about measles again. A month ago, we gave you the bad news about the measles outbreaks and how measles numbers in 2025 were vastly greater than in previous years, all due to parents not vaccinating their children. Now the news has gone from bad to worse. Just 2 months into 2026, we're already at over half the number of measles cases as last year. Sadly, you've never been able to rely on the CDC's website for measles tracking since it ends up being woefully behind the current numbers. But their current number is 1,136, a number that is at least a week behind. As we reported, the total number for 2025 was 2,281, so the CDC's number is just under half. By now, it's almost certainly more than half. A week ago, when it was known the number of cases was over 1,000 but the CDC still said 982, Martha Edwards, president of the South Carolina chapter of the American Academy of Pediatrics, said, quote, "It is very concerning to see more than 1,000 cases in the U.S. this early in the year. Already we have more than half the number of cases seen in all of 2025. And the number of cases in 2025 was one of the highest annual case counts seen in decades. As people continue to believe inaccurate information about vaccines, and as non-medical exemption rates continue to rise throughout the country, we can expect case counts to continue to rise, threatening children and immunocompromised individuals with a disease that was nearly eliminated in our country through vaccination. That includes the South Carolina outbreak we discussed a month ago that spilled over into North Carolina. The most recent data I could find for that was 979 confirmed cases since October, just 5 months, so that one outbreak alone is outpacing 2025 as a whole. South Carolina State epidemiologist Linda Bell said, quote, "It is always concerning to see an increase in vaccine-preventable diseases in our communities. However, with a decrease in overall vaccination rates for diseases like measles, there are likely to be increasing numbers of these outbreaks in the future. This is especially true in areas where larger groups of unvaccinated individuals reside, as has been the case in Spartanburg County. That's in addition to the Arizona-Utah outbreak, likewise in counties such as Mojave County with lower vaccination rates. It's amazing how you can predict the location of these outbreaks just by the low vaccination rates. It's almost as if vaccines work or something. Once again, measles is not some harmless childhood illness. 1 in 5 unvaccinated people who get measles end up hospitalized. Common complications are pneumonia, brain swelling, often resulting in permanent brain damage, permanent damage to the immune system, and even death. Even if you survive the measles itself, years later you can get a fatal brain disorder called SSPE. Years! Long after the rash has gone away. Immune amnesia can wipe out all of the immunities you've built up, including all-important ones obtained in infancy, basically making you start over. And the immune system is not as good as learning about it as it was before, so you got your work cut out for you. Before widespread vaccination, measles killed millions every year. It wasn't better nutrition or clean water or anything that stopped that. It was vaccination. And when you vaccinate yourself and your children, you're not just protecting yourselves. You're protecting babies too young to be vaccinated, cancer patients on chemotherapy, people with immune disorders, pregnant women, and many others. With such a high reproduction number, you need 95% vaccination rates to have herd immunity, and measles will burst through any crack in that door. Vaccines are cheap, effective, and prevent so much death and misery. They're one of the most successful health inventions in human history. I don't care what your nostalgia is telling you. Look at the data, and the data are clear. With vaccination, measles is rare. Even a slight dip in vaccination rates, and you get outbreaks. At this point, I don't know how stupid you have to be not to accept that.